like to become a neurosurgeon myself.
Okay.
Could you tell me a little about what you do?
What do I do?
Yeah.
Well, when you're a surgeon, you do surgery, and then you see patients in the office. So I'm in surgery 3 days a week. I'm in the office 2 days a week. Today's an office day. And in the office days, you see new patients and talk about having surgery, see old patients and follow up after their surgery, and other patients that we monitor. Surgeries that neurosurgeons do have to do with the brain, spine, and the nerves. So we I do some pediatric neurosurgery, so I do some surgery on children that have problems with their brain.
Sorry. What are the basic steps to become a neurosurgeon? Like, how many years of medical?
So you need 4 years of college, 4 years of medical school, 7 years of residency. During residency, you're actually doing neurosurgery as part of a training program. So somewhere around 30, 32, you'll be able to start working.
How many years of residency?
7. So you're 18 when you graduate from college, or 18 when you graduate from high school, 22 from college,
Wow.
26 from medical school, plus 7 is 33 when you get out of residency. 30, you're done training at 33.
Why did you choose to become a neurosurgeon? Was it because of the salary or something?
Oh, I actually, when I decided to become a neurosurgeon, is because I spent some time during medical school. I spent a month rotation on neurosurgery, and it was the most fun I ever had. I really enjoyed it, so I decided to be that. The decision, you know, the money is nice because it's one of the things that pays better than most other doctors, but it also has lots of bad things about it too.
What is it like to do an operation? How does it feel when you're operating? What are the basic, pretty much, steps?
Well, you know, many of the surgeries are ones I've done hundreds of times, so they're really pretty basic. And so it's just doing something with my hands that I enjoy. It would be the same as a cabinet maker building a cabinet, a very complex thing, but he does it so often. It's enjoyable. You know, all of the surgeries are completely different. There are basic principles of surgery that you do the same. But you know, it's a lot of what I do a lot of times in different people. It's just you become very good at something.
If you weren't a neurosurgeon, what would you be?
Boy, I don't know. Maybe I would have been a researcher. Maybe I would have been I mean, if I was a doctor, what kind of doctor would I be? I mean, I probably would still have been a surgeon of some kind. I'd much rather be a surgeon than an internist or another non-surgeon doctor.
Did you want to be something else when you were young?
Well, I was going to be a pharmacist. And I went to college, and actually I have a degree in pharmacy. And I went to pharmacy school, and then I just decided that I wanted more contact with patients. And I didn't want to run a drugstore. And that's what a lot of the pharmacists did. They ended up being drugstore managers, and I didn't want to be a drugstore manager.
Not to be pushy, but have you ever thought about failing an operation, doing an operation?
I've thought about failing when I do an operation?
To elaborate, have you thought anything negative in an operation?
Oh, I mean, there are times in any job when things don't go right. When somebody, and you know, in surgery, people can, you know, start bleeding, and it can be very difficult to stop the bleeding. Or the brain can swell, or something can happen. that can be very scary. And you know, people, there's no doubt if there are times if I make a mistake, somebody could die or be paralyzed for life. And not even making a mistake, I could do everything perfectly, correctly, by the books, and the patient wake up with a problem. And so that's part of why not very many people want to be neurosurgeons. There's a lot of pressure, a lot of stress.
How do you relieve all the stress? Is it still there?
I go fishing.
What are some basic operations?
Well, I mean, we operate on the brain. On the brain, we take out tumors. We take on trauma, take out blood clots from injuries. At the State Fair crash, we were actually doing brain surgery on 4 patients at one time in this hospital.
Huh.
Taking out blood clots and other things. On the, the other thing in the brain, I put in devices that make life better. I put in shunts into the brain that drains excess spinal fluid. I put stimulators into patients to treat pain and to stop seizures. We put in stimulators to help people walk and Parkinson's. I put in pumps that infuse drugs into people, into their spinal fluid to help them walk better and help with pain. We do spine fusions where neurosurgeons, after people have broken their backs, do surgery to help them be able to get up again and walk again. We do surgery on certain nerves, when nerves get cut, put the nerves back together. When nerves get stretched or compressed, we can operate on that. Ruptured disc surgery is one of the most common surgeries we do.
What tools are used to do a shunt?
Oh, a shunt?
Yeah.
Really cool tools. I mean, we use a scalpel to open the skin. We use coagulating pens to stop bleeding. We use high-speed drills to drill a hole in the skull. Air-driven drills that very high speed, cost $10,000 a piece.
What are they called?
They're high-speed drills that we use to drill a hole. We have navigation systems that take the computer data from a CAT scan and feed it into another computer, and allows us to be able to steer a tube anywhere in the brain within 1 millimeter accuracy. It lets us look on a scan on a TV monitor and show where our tube is going through a tiny hole. And then we have scopes. I have like the scopes they do for knees and gallbladders. We actually have a scope that allows me to see inside the brain, and I can navigate inside the spinal fluid chambers of the brain and get shunts to where I want them. So I have about $750,000 in equipment sitting in the operating room when I do one of my shunts.
Wow.
My son just got a new job working for playing video games for a living. He works for the one that made the brand name MMR, the Man of War, whatever the new.
Oh, yeah.
He helps run the website and looks for cheaters. So he plays video games for a living, and I yelled at him for years that he's never going to make $1 playing video games. And now he's got a job playing video games. Life is good, so study hard. Maybe you can get a job playing video games. But we do video. I mean, it's we operate. We look at a TV and do things over here. We operate looking at a TV, showing us where the tip of the things are. Yep, it's pretty cool.
Yeah. Can you tell me a little about the brain? Some interesting facts.
Oh, interesting facts about the brain. Well, your brain is still developing until you're 18 years old. You're still improving your brain and adding on structures in your brain. Normal brain weighs 14 pounds. How's that?
Wow.
There are two sides of the brain. They're called hemispheres. Each side of the brain has a number of lobes. The frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. There's a brain stem that connects to the spinal cord. Is that enough facts about the brain?
Couple more.
Oh, okay. The two sides of the brain are connected by something called the corpus callosum. And that's where the white matter, most of the nerve cells are on the outer layer of the brain that people call the gray matter. And the white matter is really the nerve cells coming from the brain cells. They're kind of the wires going from the mothership, the CPU. The nerve cells are kind of like the computer, and the nerves are the wires going between the nerves to talk to each other.
Is there anything you would like to add?
Well, study hard to become a neurosurgeon. It's very competitive. Most of our residents now were straight A students through everything. One of our residents who's studying now was first in his class in law school, then went to medical school, and now is a neurosurgeon. So you have to be smart and you have to know how to study. It's pretty competitive now to get in to be a neurosurgeon. They're all the smartest in their classes. So study hard.
Okay.
And the other thing is make sure you like what you're doing. You can't be a neurosurgeon if you don't like it. And no matter what you're doing, if you're not having fun, find a new job.
Back to one question. For the operations, have you ever, has an operation gone bad for you?
Have I had a patient have a bad outcome from an operation? Yes. Have I had a ton of bleeding and had to work hard to stop it? Yeah. I've had people die on the table. Yeah.
When a person passes, do you like feel anything for them?
Oh yeah. I mean, yeah. You can't do this, and because I do pediatrics, I'm the one who has to walk out and tell the parents their kid just died. That's pretty darn tough. Or to go out and tell anybody their wife died, their son died, and that's what I do. I go and tell people their child has a brain tumor and has only 6 months to live. Yeah, that's the bad stuff about the job. We also have to take call, which means we have to work all night. Work all day, work all night, and work the next day.
How long does the surgery usually last?
Oh, most of the surgeries we do are 2 hours, 2 to 4 hours. Some are less, and then there's some surgeries that take 10, 12 hours.
Does the memory of the passing stick to you, like for a very long time?
Something about every surgery sticks with you. The goodness, because you're always learning. So maybe you learn a little nuance, how to do something a little bit different, kind of a little trick of the trade. You're always working, trying to make things easier or faster or safer.
Thank you.
Is that it?
Yep.
All righty. You're welcome.
Thank you.
Okay.